And it's not just local hospitals that are seeing a COVID surge. Secondary care facilities like respiratory hospitals are also seeing a spike in coronavirus patients. For many of them, the recovery process can be a long one. CBS 2's Christine Lazar shows us how one local facility is handling the influx of patients.
You may have passed Barlow Respiratory Hospital on the way to Dodger Stadium. It's been here since 1902. The long-term acute care facility has seen Los Angeles through the 1918 flu pandemic, tuberculosis, and polio, and now COVID.
At this moment, we have about 20% of our patients are recovering COVID patients, but I can tell you based on the referral patterns of patients who are trying to get into the hospital, it's definitely going to go up.
Medical Director Dr. David Nelson says about 20% of those hospitalized with COVID need a ventilator, and 20% of those who go on a vent can't get off of one.
Our patients will have not only lung disease, but they'll have issues in many cases with kidney failure, heart disease.
There are also the lasting side effects of coronavirus that are not life-threatening, but life-changing, according to Dr. Nelson.
Up to 70% of people have complained of long-term shortness of breath. But more commonly, it's things like generalized fatigue, just aches and pains that they didn't have before.
The average stay for a COVID patient at Barlow is about a month, but many move on to another inpatient facility after they leave here. Dr. Nelson says he only knows of one COVID patient that was able to leave Barlow and go directly home.
By the time they get to us, even people who were, before they got sick, were perfectly normal people. By the time they get to us, having been in the hospital for a month, let's say, they're no longer functioning like normal people.
And because of COVID, the hospital has a no visitor policy. So the COVID patients who come here after a lengthy hospital stay are still not able to see their friends and family. Their only contact is with their doctors and nurses.
The patients are isolated in more ways than one. You know, they're isolated with technology around them. You know, the ventilator makes it so that they can't communicate effectively. You know, they have only us, their caregivers, as emotional support.
Dr. Nelson says he's concerned about having enough beds and staff to handle the post-holiday COVID surge. He's asking Southern Californians to mask up and stay home as much as possible. Christine Lazar, CBS 2 News.